So this video will cover sharp safety. I will demonstrate how you can load, unload, guard, and pass a suture needle. I will also demonstrate how you can load, unload, and pass a scalpel handle with a blade. So first, let's go through a suture package. Here we have the suture needle. Make note of the swedge of the needle and the point of the needle. Here, this suture needle actually has a suture attached to it on the swedge side. Okay. So now I will demonstrate to you how you could actually load the suture needle onto the driver. Here I have a needle driver and the suture package. I will place the tip of the needle driver in 1/3 from the swedge of the needle. I'm going to unlock the needle driver and place the tip of the driver 1/3 from the swedge, lock it in place, and remove it from its package. Now I have loaded the needle in a forehand position. Now that I have it in forehand, there's also the backhand position. The backhand position is used for surgeons who are left-handed. So to place this needle in a backhand position, I will place my forefinger and my thumb here in the needle, and I will unlock my needle driver. I will rotate the needle so that the tip of the needle is placed away from me. Once I have it in its proper position, I will then lock the needle driver. The suture is loaded in a backhand position. This suture can also be given to surgeons who are left-handed. Now that you've seen how you can load a needle driver in the forehand and backhand position, I will show you how you could actually guard a needle. At some point in the surgery, some needles may be reused again and may be kept on your sterile back table or Gerhardt table. To guard a needle, what you need to do is place your forefinger and thumb here in the needle. You would unlock your needle driver and you would rotate the needle so that the point of the needle is actually facing the needle driver, like this. Once it's in its proper position, I will then lock it in place. You notice how the point of the needle is now guarded, preventing injury to yourself or your patient or colleagues. So now I'm going to demonstrate how you can pass a suture on a needle driver to the surgeon. Some surgeons will actually prefer to have the needle driver directly placed in their hand like this. Some will actually prefer to have a needle driver placed on a kidney basin here with a towel. This is what's called a neutral zone passing. The scrub nurse will remove the suture package from the needle from the suture package, and the scrub nurse will then place the needle onto the neutral zone or your kidney basin. The surgeon will then grab the needle and the needle driver from the neutral zone. Once the surgeon's ready, he will then return the driver with the needle onto the neutral zone. It is your job as a scrub nurse to actually take the needle and place it onto your sharps container after its use. Okay. Now I'm going to demonstrate to you how we're going to load a blade onto a knife handle. Here we have a needle driver, a size 10 blade, and a size 3 knife handle. I'm going to take my needle driver, I'm going to unlock it. I will then place the jaw of the needle here onto the blade. I'm going to place it here in the dull part of the blade. Once it's locked in place, I will take the knife handle in my left hand. I will then move forward with my blade and place the blade here on the tip, through the tip of the knife handle. Once the two meet, I will then apply the blade onto the knife handle safely. Once it's locked in place, I will unlock the needle driver. Now you have a size 10 blade applied onto a size 3 knife handle. So now that we have the blade loaded, to unload a blade, you will then use the reverse. What you would do, you would actually flip the knife handle around. I will then use the needle driver. I will place the needle driver here, and I will then bend it just slightly so that it is unlocked. Once I have it bent, I will push the blade out slowly and gently until the blade has been removed. Once you're finished, you will then place your blade onto your sharps container on your sterile field. So now I'm going to demonstrate how you're going to pass a blade with a knife handle to a surgeon. Some surgeons may prefer the knife handle passed directly onto their hand. It's like this. So I'm going to lift it with my hand. You notice where my fingers are located. It's located just in the middle of the knife handle. I'm also tucking my fingers in to prevent any injury to them. I will then give the knife to the surgeon, and now he could use it for surgery. The surgeon will pass the knife back to me, and notice how she's passing it back to me. She's passing it in a way that's actually preventing injury to me as a scrub nurse. She's passing it with the blunt end towards me. As I receive it, I will place it onto my table. Some surgeons may also prefer to have the knife handle and blade passed a bit more safely using a neutral zone passing. Here I have a kidney basin with a towel. What I would do as a scrub nurse, I will place the knife handle onto this neutral zone. Once the surgeon is ready to use the blade, I will then pass the kidney basin closer to him or her, like this. Once he's ready, she'll take the blade and use it. When she's finished, she'll place it back onto the neutral zone, and I will then take it onto my table. And this passing technique is one way to reduce a sharps injury in the operating room, which is actually recommended by ORNAC.